is Dr. Linda Vanotoo. I'm the Regional Director of Health for the Greater Accra Region of Ghana. I'm responsible for all health activities in the Greater Accra Region. I work with the Ghana Health Service, but we are also responsible for everything to do with health in the Greater Accra Region. We also work with the Regional Coordinating Council, where we advise on health issues. I work with my districts, my sub-district, and the lower levels of healthcare. So at all levels of care, we are responsible for the health of the people who live there. As part of our work, we look at the cases that come to our hospitals on OPD basis, that's the outpatient department, those who come on admission, and those who die, unfortunately. We try to tease out as much as possible the kinds of diseases that our clients come to the hospital with. And we do this in all the facilities within the Greater Accra Region. And we rank them. We usually look at the first 10 reasons why people come. And the rest, that is from the 11th onwards, are put together as other diseases that people bring to the hospital. What we are talking about today, lupus, does not seem to fall within the first 10. And because the others are usually put together, even if it occurs down there, it may be lost. And that is why I believe that it is very important that attention is being drawn to the fact that there is a condition called lupus. And that is why the Greater Accra Region is happy to be part of this campaign to draw attention to lupus, to create awareness, and also to give hope to those who unfortunately may not be aware that they have a condition like this. We as a region are also happy to collaborate to get our staff to be aware that lupus exists in Ghana and that those who suffer from this condition need our care and our support. What this campaign will do is that once it's drawing attention to its existence, even in the Greater Accra Region, we as the leaders of the health sector in the Greater Accra Region would have to get our staff refreshed in terms of the condition, how it presents, how it can be managed, and the kind of support that our clients will need from us. It would also help us in looking at the kinds of conditions that come to the hospital to look out for it and see if there is one among the number of people who came. Again, we draw attention to the laboratory, to anybody who is in one way or the other connected to the care of our clients. And this will help a lot. This, I believe, will go a long way to let people who unfortunately suffer from this condition to know that they are cared for by the health sector and that they have not been forgotten. Again, I believe that it will help a lot when it comes to looking for resources to manage such conditions, including even the medications that are used, because you realize that it costs a lot to manage such conditions because it is a chronic thing and the person would have to be managing it over a long period and definitely will need help. Again, we have a counseling unit, and that will help us to draw the attention of our counselors to the fact that there might be somebody who will need help in terms of counseling to ensure that that person is able to live with this condition, but also live a healthy life. Any condition that you have, I believe that the mind is very strong, and once you get the support, you'll be able to go through. And people will also not be afraid, people will not stigmatize them, people will not discriminate against them once they understand and they know how this condition presents and what can be done. And again, the fact that women are mostly affected than men, if we are able to draw attention during clinic times, even with people who are pregnant, our staff will be aware that if somebody comes and presents with any of the symptoms that can be lupus, then they will be aware of it and will look out for it and will diagnose those who have them and properly manage them and help them in every way. I believe that this is something that the Ghana Health Service can do, and the Greater Accra Regional Health Directorate can also do. With the Oyemam Foundation going out to do advocacy, we can bring in policymakers, the founder telling her own story. We can bring in people who may have the condition but are hiding because they don't know that they can get support. Again, we can get our own health staff to be aware so that if somebody comes with any of the symptoms, that person can be investigated thoroughly and will not just look for the common diseases that we have around. I think that would be very, very, very helpful. The other thing is that with Oyemam Foundation, because she herself has gone through even the most difficult season of this disease, she'll be able to inspire hope in those who have it. Going around talking to people, another thing it will do is to help families who have other relatives who suffer from such condition to be able to have hope and therefore support them. We are aware that the management is expensive, and therefore drawing attention, creating awareness, bringing even the pharmaceutical companies in would help. And my hope is that through the Oyemam Foundation, we'll have pharmaceutical companies that will come in to support, and if possible, to be able to produce medications that will be within the reach of those who might need those services. It will be very good. Again, the Oyemam Foundation can go even to the lower levels, to schools, to churches, to anywhere that people gather to talk about lupus. And then also they can have one-on-one discussions with people. And if anybody hears them talking on radio or on TV, I believe that if they have any of such symptoms, it will help us as a service, because then they will come to us and we'll be able to investigate them and treat them. I would like to congratulate Oyemam Foundation. In fact, this is a very good thing that they are doing, creating awareness about a disease that people probably have not heard of before. Another thing is I want to congratulate them because some people, if they continue complaining about one thing or the other, and they go to the hospitals and their diagnosis is not made, the family may think of sending them elsewhere, probably thinking that they are feigning it, or they are witches themselves, or somebody somewhere has put juju on them. This is a very good thing that they are doing, and I'd like to call on people to support them in every way possible so that more awareness can be created, but above all, more support can be given. And as they say, to inspire hope for people to live on. So congratulations.